and welcome to your Chapter 11, Administering Medications. This is an exciting chapter because we're going to jump right into preparing for our injections. Let's look at learning objectives. So learning objectives, lesson 11.1, Administering Medications. Define, spell, and pronounce the terms listed in vocabulary. Be able to do the following related to safety and drug administration. Follow safety precautions in the management of medication administration in the ambulatory healthcare setting. Analyze safety guidelines for specific patient populations. Document the administration of a medication accurately in the health record. And obviously, safety is imperative here. Summarize patient assessment factors that can affect medication administration. Identify various drug forms and their administration guidelines, and administer oral medications, as well as be able to do the following related to the parenteral administration of drugs, or it's also parenteral. You'll hear it said both ways, so I use it interchangeably here. Specifically, parenteral administration equipment, including details about needles and syringes. Follow OSHA guidelines in the management of parenteral administration. Describe and demonstrate the types and locations of parenteral administrations with proper use of sharps containers. Recognize the medical assistant's role in coaching patients about the administration of drugs. Assess legal and ethical issues in drug administration in the ambulatory care setting. And complete an incident report related to an error in medication administration. Let's start here first with the safety and drug administration. This is key. So the patient always has the right to refuse to take a medication. It's very important to know and understand that. You always want to confirm the patient's name, and we usually do name and date of birth for the right patient. The right drug, you want to check the label 3 times, right? We've been practicing this, the 3 med checks. The right dose, we perform the pharmacology math to determine accurate dose. And if dose is ordered, it needs to match the drug label, right? So we need to make sure everything matches there. And the right route, to clarify the route of administration on a physician's order. So how many times should a drug label be checked before being dispensed? And we already went through that, and we've been working on it since last semester. So you know that answer is 3 times. It should be checked every time a drug is dispensed. The label must be checked 3 times to confirm the right drug, dose, and strength. And check the physician's order to clarify the route of administration. Okay, so we know that we have our 7 rights, and we're starting to go through these rights now. And this has to do with the safety. So now we're looking at the right time. Check the physician's order to clarify time of administration, the right technique. It's important to be familiar with proper techniques for all routes of administration, and the right documentation. Immediately after administration, document the date and time, the drug name, strength, dose, and route of administration. And in certain instances, especially when you are doing immunizations, it's important that you also take information on lot numbers. So again, specific to protocol, making sure that you know the correct protocol of what to document, and make sure to include any patient reaction and details of any patient education regarding that drug. How does one document a parenteral administration? So how do you document this? So for the parenteral medications, you inspect the site of injection before administration. You want to make sure to look for scarring, altered pigmentation, or any other indications of possible problems with medication absorption. And you want to make sure that you document this in the exact site of administration must be charted also in your documentation. If you look at procedure 11-1, it does describe how to administer oral medications. And so take a look at that as well. So our patient assessment factors, many factors may have been an impact for the patient's compliance with drug treatment, as well as the safety and effectiveness of medication therapy. So let me ask you, when should a patient be asked about drug allergies? And we know this, every time the patient is seen in the office, he should be asked about drug allergies. We've been practicing denoting this in red pen on our written documentation, as well as it needs to be documented in the EHR. Very, very important that that is done every single time. Also, if you have the actual files in the office, there should be a red box documented on the front of that patient file. You'll go with the protocol of your office. Again, we're using EHR in most instances, but sometimes we do have backup files as well. So patient assessment factors continued. So we look at age, weight, and height, and these must be documented to determine the correct dose. Chronic conditions may affect the body's ability to metabolize and excrete medication. Patients must understand the drug regime and they may need family support. So we've talked a lot about this before, like what gets in the way of these patients taking their medication. And sometimes with that family support or coming up with ideas of how to get certain pill containers with the days of the week or whatever it is to help them understand and comply with their medication orders. And affordability is huge. We all know, I'm sure we've all been there with a medication that is so expensive. If it's difficult to afford and we can't afford it, then a lot of times we're not complying because we don't have the money to purchase it. And there are, again, resources that we can help our patients with in order to make sure that they can get the medication that they need. Approaches to special patient populations. Again, we learned a lot about this last semester with pregnant patients as well as our elderly. So pregnant or nursing women should use caution when taking medication. Be sure that you are giving correct dose to children because this can be actually fatal if they are misdosed. And be aware of metabolic rates in older patients. So a pregnant woman should not take any medications without the knowledge and approval of her physician. Pediatric doses are determined primarily by the child's weight, and we're going to learn how to do this, and it's very specific. Therefore, it's important to measure and record the child's weight accurately at each office visit. And here's another example of why collecting the proper and correct vital signs is so important. The metabolic rate typically slows with the aging process, as we've talked about before. So this results in increased susceptibility to buildup of chemicals in the body that can lead to a toxic condition. Assessment of the patient's environment. So the patient's surroundings affect the success of their medication therapy. Administration of certain medication requires presence of the physician, and or in certain instances, certain medication is not within your scope of practice and needs to be administered either by a registered nurse, a physician, a physician's assistant, or a nurse practitioner. Because of the risk of anaphylactic shock, allergy injections should not be given unless a physician is in the facility, and this is a physician needs to be in the facility for scope of practice. Either, again, the physician, physician's assistant, and or nurse practitioner. It's really important that we start understanding our scope of practice. Emergency drugs must be available to counteract any adverse effects that might occur immediately after administration of a medication. And so it's really important to know where the crash cart is, make sure who's in charge of stocking it, and that that's checked regularly. I have had an incident in my office where we had 2 different anaphylactic incidences within a very short amount of time, and the Benadryl had not been restocked by the person who was in charge of restocking. So it's really important that we work together and communicate because it, of course, increases the response time to that emergency. So let's talk about gathering medication information. What provider prescribed drugs are you currently taking? Do you take any over-the-counter drugs on a regular basis? What medications have you taken over the past 6 months to a year, and why? Do you regularly use any alternative or herbal products? If so, what are they? It is important that the patient take their medication as prescribed, and so focus on a few questions on how current and what's been prescribed and how are they taking it. You can get a lot of information from just these sample questions that I just read for you. And you can see, if you sit here with that for a moment, how much information out of those, what is that? That was 4 or 5 questions that you can really get that information on the compliance. If a mother reports that her child has a fever, but the temperature is normal at the time of the visit, perhaps she gave the child a dose of Tylenol before the visit. And she didn't tell you that because she's worried about the child and didn't really think of it. But it's important to think of those things, know that, and ask those questions. So if a child came in, mom reports the fever initially in the chief complaint, child's now normal, your brain should go ding, ding, ding. Oh, did you give your child any medication prior to help with the fever? And that would help give that information so that you can share that with the physician to see what's going on. Here's some more questions you might ask. Where do you store your medication at home? Have you checked the expiration dates on your containers? It's amazing how many patients have medications that have been expired for over 5 years in their cabinets, but they don't think to go through it. So by asking and having this conversation, you can make sure that they keep that medication cabinet up to date. Some more questions. Can you tell me why you are taking the prescribed medications? Because when they understand why, they're more likely to comply. Do you use the same pharmacy to fill your prescriptions? And again, this is something that you'll ask them about their pharmacy every single time that they come in, because they might have changed their pharmacy and you might be prescribing, your doctor, not you, obviously, your doctor might be prescribing a medication that they're going to pick up at their pharmacy. And if the computer has the incorrect pharmacy, then they will not have that medication ready for them when they get there, and that doesn't work out well. So we always check to make sure we update their current pharmacy. An excellent method of keeping track of all prescribed drugs, contraindications, and possible drug-to-drug interactions is to strongly suggest that the patient use only one pharmacy. This way, all of that information is there, and it will typically, not always, you can't count on it 100% of the time, so it's important to be aware, but it should come up and generate these things in the computer so that that can be fixed prior to any problems. So let's look at some drug forms and administration. Solid dosage forms, so there's tablets, capsules, lozenges. Tablets are usually coated with something because as we take it, obviously our stomach acid can eat into that. So they typically have a coating so that it can make it to that digestive system and be ingested into the system. Capsules may also be time released. Liquid and oral dose forms, we have syrups, suspensions, gels, and extracts and fluid extracts. So a tablet is a compressed powder or granules that, when wet, break apart into the stomach or into the mouth if they are not swallowed quickly. The mouth can break it up. A capsule are gelatin coated and dissolve in the stomach, or they may be enteric coated to protect them from the stomach acids. Lozenges, these are flattened discs that are dissolved in the mouth to coat the throat, such as a lozenge, for a sore throat.